I think there are two things. One is the need for a culture of safety. You can't just simply process and create procedures, but in fact you need a culture. It's that patient safety should be, or quality should be in our DNA, if you will. And second is creating a system that supports the culture. That is for the individual practitioners and for the patients to be engaged in order to improve the quality of care and reduce the harm that we do inadvertently. Well, you know, it's important to consider quality of care in low and middle income countries because so much of work is done in high and middle income countries. So we need more research in those areas. But the early studies, the 3 or 4 publications, show a high level of errors, diagnostic errors, etc., and in fact a significant amount of injury being performed through the care delivery. Now, when we think about where we're going today, that is the post-2015 initiative towards universal health coverage, the Sustainable Development Goals, number 3 of universal health coverage. I think coverage is only a portion of patient care. You can get covered with good care or poor care. That's why it's important to know that quality has to come along with the coverage and access issue. The importance of focusing on quality in low and middle income countries because first, most of the research are done in high and middle income countries. And with a push towards universal health coverage, the SDG goal number 3, we want to be sure that the quality of care is good while you're expanding coverage. There's no point in having coverage if the quality is not good. We don't know that. That's the point. We don't know if the quality is improving in low and middle income countries. So far, the data would suggest there's a long way to go in order to close that gap. Yeah, I think this is why one needs to create a system by which people all work together and not across silos. That includes the providers working as a team, but also engaging patients, patients' family, as people who can provide input and advice. The challenge of working in this area is the diversity of individual systems and providers and so on and so forth, and trying cultures to bring them together. I think that's a big challenge. And that's why I think the way to approach this has to be a system-wide approach that's bringing everybody under the tent, working not in silos, but together, and creating a culture that works for everyone. Yeah, to be able to move from bench to bedside, we need a system that supports research and translational research particularly, right? That enables us to ask the question, do the analysis, and quickly translate into studies that measure the outcome, and of course, if it's successful, being adopted quickly, right? So a system of translation, and I do believe that NIHR is creating those kind of support for doing research and translation in care. So I think the idea of bench to bedside to even the population is something that we need to support. We believe the National Academy of Medicine, or the IOM, has had great influence in this area because we frequently credited with the first report 17 years ago called The Air is Human, where we pointed out that harms are developing within hospitals where we actually provide care to patients. The single most important lesson is the need first to emphasize quality and safety, creation of a culture that supports high quality work, and finally, a system that supports and creates an environment for such a culture.